In this video, we'll be going over common medications seen with COPD and also used for asthma. The bronchodilators, beta-adrenergic agonists such as albuterol, anticholinergics or antimuscarinics such as ipratropium, methylxanthines such as theophylline, phosphodiesterase 4 inhibitors, mucoactive drugs, steroids, and a quick mention about antibiotics. So here we go. The first category is beta-adrenergic agonists, which are part of the bronchodilators. The way they work is to stimulate that beta receptor in the sympathetic pathway, which is your fight and flight pathway. And since you're stimulating that, remember when we kind of run or fight, we open up our lungs. So stimulating that opens your lungs. This can be given by a meter dose inhaler or nebulizer. You see the lady in the picture getting a nebulizer. The examples for short acting, which would be used like in the emergency room or for rescue inhalers, PRN, shortness of breath, is albuterol and levobuterol. The long acting ones, which are usually in those combination inhalers that they take for maintenance, are salmeterol, alformoterol, and you can see the other ones there. I'm not going to try to pronounce those. But anyway, you can see again this ending that's common to betas. The only difference is it's not a LOL, but a ROL, R-O-L. And you can recognize that it does kind of sound like those beta drugs, except this time they're not beta blockers. They are beta agonists, which means they stimulate the beta. The other way to remember the short acting from the long acting is the most common short acting one is albuterol. And you can remember the A in albuterol for the A in acute. The dangers of albuterol is that by triggering this fight and flight throughout the whole body, it causes the whole body to be in this state of like excitement. So there could be tachycardia, irritability, insomnia, shakes, even some chest pain, nervousness, headache. Their GI system's not going to feel well, maybe some diarrhea, vomiting. And we really do have to be careful. There's this thing called a paradoxical symptom, and that's when you give a medication and it actually does the opposite of what it's supposed to do. So in this case, we're giving it to open the lungs, and we have to be careful that there's not a paradoxical bronchospasm. And so you just watch out for that. So after knowing the dangers, and the dangers is just my short way of saying the bad side effects, then we have to consider our duties. And so what are our nursing duties? It's really to monitor that tachycardia, and then of course the other, which I call hyper symptoms, and make sure that they're tolerating them okay. So you can see as we go through, this is going to be our setup. We're going to talk about the action, then give some examples, and then dangers and duties. Dangers being side effects, duties being your nursing responsibilities. This is also a quick, nice way of doing a medication flashcard. So if you want to take a screenshot, you can kind of cheat that way. Screenshot it, cut it out, and then you have your foundational medication card, which you can add to if you want. Next category. Another category that falls under bronchodilators is the anticholinergics. They can also be specifically called antimuscarinics because that's the specific receptor that they block. So you might hear that word too. That's their category. And the way they work is to block the parasympathetic side. And the reason we want to block the parasympathetic side is because the parasympathetic side is known as the rest and digest. And when somebody's in a state of asthma, we don't want their lungs resting. We want their lungs open. And that's why it's an anticholinergic. So if we stop that restful state of the lungs, the respirations increase, the lungs, they won't kind of close, they'll open instead. And the other thing that anticholinergics do is they decrease mucus, they dry up patients. And again, this can be given by a meter dose inhaler or nebulizer. In this case, we have the little boy getting a nebulizer, but this time by a face mask. The examples are the ipratropium, tiotropium. You can see the common ending there. So what are the dangers or what are the side effects? Because they stop this kind of rest and digest idea, think of things as hyper again. Irritable, maybe some confusion, delirium, they can't sleep, their vision even becomes blurry. The other thing is they stop digestion. So if they stop digestion, because remember we're blocking rest and digest, they stop saliva, they start to get some heartburn, some constipation, they can't urinate. So those are all some problems with them. When I was in nursing school, I learned that the side effects of anticholinergics were they can't see, they can't pee, they can't sit, they can't spit, and they can't and I'm not going to say that, but I think you get the point. And so my nursing duties here are to monitor for side effects of blocking that pathway. And because of the side effects of blurry vision, there's somebody that really shouldn't get that drug, and that's people with glaucoma. Another medication category is called methylxanthines. So these relax the muscles in the airway. They're used in combination usually with bronchodilators when the beta agonists and the steroids aren't enough. They're not first-line drugs. It can be given PO or IV. And the example here is the theophylline. And you might see that cup of coffee in the corner and wondering why that's there. Well, methylxanthines can cause a fast heartbeat, tremor, nausea, vomiting, headache, trouble sleeping. Again, they kind of open up those lungs like the bronchodilator did. And so our duties are to monitor for that tachycardia. And also, this is one drug that you do have to check their serum levels because they cannot go higher than 20 micrograms per milliliter. So if you've ever noticed, anytime you're kind of looking at a drug and making sure it doesn't go too high, the high number usually has a 2 in it. So like all your digoxin, your lithium, it's like close to a 2 is dangerous. So again, we're at like a number with a 2 in it, 20. And then make sure that the patient doesn't have any caffeine. I remember looking up this category once, and I read something along the lines that when we drink caffeine, it turns into theophylline in our bloodstream. So that would just make sense then, that the side effects, if you look at them, they look to me like what happens to me when I drink too much caffeine. And also, it makes sense then not to let them drink that cup of coffee. So theophylline and caffeine, they kind of rhyme, and we're going to go with that. So if you can remember that connection, that makes this drug a little easier. The next medication category is the phosphodiesterase 4 inhibitors, also known as PDE4. And when that is blocked, it actually also blocks these cytokines which cause inflammation. That's why they're called pro-inflammatory cytokines. You're going to hear cytokines in nursing school a lot. If you can connect that with inflammation, you're going to do well with that word. And so if we block the cytokines, inflammation goes down, in this case airway inflammation. This drug is used for severe cases. It's usually taken PO, 1 pill a day, and used in conjunction with the long-acting bronchodilator. The example is roflumilast. And the problem with this is lots of like more GI issues, diarrhea, weight loss, cramping, maybe some headache, tremors, and insomnia. So just watch for the GI issues there. And there is a note to use caution in people with liver failure and depression. Another category of drugs that the patient might be on are mucoactive drugs. These kind of sound like they're mucus activating, but they're actually not. They thin out the mucus, they reduce the mucus, and therefore it's easier for the client to cough them up. They can give them PO, pill form, liquid form. Examples, carbocisteine, erdocysteine, and acetylcysteine, commonly called NAC or NAC. You might have heard of that one. The dangers here are mainly just around some GI issues. No big problems with those usually, so just monitor for those GI symptoms. One that's a little bit more common is guaifenesin is also used to thin out the mucus. We call it an expectorant. And just make sure if somebody's taking guaifenesin that they take that with a full glass of water to help the medication thin the mucus. Steroids. I feel like a lot of nursing school is talking about steroids. So steroids work by decreasing inflammation, not just in COPD or asthma, but any disease process where there's inflammation. Steroids could be a choice. They can be given IV, oral as a short course for treatment for exacerbations. In this case, steroids can be given inhaled for maintenance or preventive as metered-dose inhalers or nebulizers. The examples are prednisone or methylprednisone. Corticosteroids, inhaled versions are the fluticasone or budesonide. Fluticasone is also a nasal spray. If you have somebody with some hay fever or like allergies, you might see them using that as a nasal spray. Dangers with steroids. Steroids are glucocorticoid. So if you heard that prefix, glucose, they cause high blood sugars, increased risk of having some possible diabetic effects from that. Steroids also, because they suppress inflammation, they do suppress the immune system, and therefore your client might be at risk of getting infection. They cause weight gain. If used for too long, it can cause osteoporosis, cataracts, thinning of the mucus lining in the stomach, causing GI upset. If we have a client on inhaled steroids, we have to watch for oral infections, especially thrush. Our nursing duties are to monitor for all these side effects, the hyperglycemia, signs of infection, and we have to remember that if a client is using this as an inhaler, that they need to wash out their mouth after every use to prevent that thrush. Last category here that I want to mention are antibiotics. If your COPDer catches a bacterial infection, it's going to make their COPD worse, and so antibiotics could be part of the medication regimen for them. And you can see probably the sputum specimen will be taken, it'll culture, and we have this petri dish in our picture showing some growth here. And if that is bacterial growth, they will be put on those antibiotics, and the most common one in this case is azithromycin. At least at this point, we are getting some resistance to that, but azithromycin is still the one that we would use. Thanks for joining me on this quick review of all the respiratory medications for COPD, and we did talk also that they included asthma. Asthma does have some other medications as well, but these medications could be used for both. Hope you enjoyed this. If you like this content, please subscribe to our channel. You can find us at sciencestrategies.com, and don't forget to like this video.